We switch gears now and focus on your health. Brought to you every morning by LRG Healthcare. Little frog in the throat there. Excuse me. Let me introduce our guest this morning. He is Dr. Chandler Marietta of ENT Associates. That would be ear, nose, and throat. Doctor, welcome. Thanks for coming in this morning.
Thanks for having me. You
are kind of new to the area. Tell us a bit about yourself and your medical training and your specialties.
Sure. Well, I grew up in Michigan, and after moving around a little bit, ended up at university in Michigan, at Western Michigan University, where I was lucky to receive a scholarship there, and ended up going out to Nebraska to work at a hospital system out there for a year before going to medical school at the University of Rochester, in Rochester, New York. Where I went to medical school and then went to training after medical school called residency in ear, nose, and throat surgery, or otherwise known as the very long and complicated word otolaryngology.
Well, that's a mouthful. It's an earful, too.
Since graduating there, I then went to Minnesota and joined a group where I received more specialized training in ear surgery.
And that brings you to the Lakes region. And we were kind of joking off air that this was your first winter here. Mm-hmm. But then I thought real quickly, wait a minute, he lived in Minnesota, so winter's nothing to him, right?
Right, exactly.
But anyway, you got through it, and you're here in the Lakes region. And we're going to get to this a little bit later, but you specialize in some surgeries that really, if you weren't here, folks might have to go to Dartmouth at a minimum, maybe Boston. No other place in New Hampshire, I think it's safe to say, offers this kind of surgery. And we'll get to that in a minute. But, you know, I was thinking, our hearing, our ears, it's number one, it's one of the most exposed organs we have, of the major organs. And number two, we kind of take it for granted until we keep saying to that person, what you say, huh? Really, so give us some basics about the ear.
Sure. Well, it's a rather complicated organ, as most organs are, once you learn more about them. There's kind of an outer portion, obviously, that sticks out of your head that most people can see and know about and are aware of.
And make fun of.
And make fun of sometimes. And sometimes people have deformities there. And then there's an ear canal, which is kind of, the hole on the side of your head. Mm. And then there's an eardrum and in a middle ear space, which is an air-filled space with hearing bones within it. And then that transmits sound to the inner ear. And the inner ear is that, as most people have seen pictures, is that snail-shaped organ called the cochlea.
Mm. How does it work? Vibrations in the ear or something?
That's right. Sound is vibrations. That's exactly right.
Yeah.
And it's carried through all of those structures, and each of those structures helps to a certain extent, and eventually carry to the cochlea, where cochlea is a fluid-filled organ, and it's those sound vibrations that causes movement of that fluid that's then transmitted to the nerve in the cochlea, which is then transmitted to the brain.
Amazing. It's just amazing when you stop and think that as I move my mouth, vibrations are floating to your ears, and your brain is translating that. Wow.
Yeah,
it is a little amazing to think about. And of course, hearing loss is a big thing, and I suspect there are as many reasons as there are people for hearing loss. What are some of the major ones?
Well, by far the most common reason is just, for lack of a better way to describe it, age-related changes. Mm-hmm. And that is, again, kind of a complicated set of circumstances. It's not only age that causes the hearing loss. It's simply your genetics, kind of what you were born with. It's all of your exposures throughout life, both sound as well as probably what we take in. And then certainly there's a component that perhaps the organs and the structures within that are important in hearing weren't quite what they were when they were when you were younger.
Got a few miles on 'em, huh?
Right.
Yeah, just like other organs, they tend to wear down over the years.
Right. Absolutely.
Yeah, go ahead.
And then another very common one that people are aware of is noise damage. So, and that's unfortunately become a big issue with especially with iPods and with the music that's available today and how we listen to the music.
Yeah. I want to get to some of the specialty surgery that you do. It's really fascinating, but I think it's a fair statement to make that prospects for people who have either lost their hearing totally or lost a significant portion of it, prospects for that to be rectified are much better today than they were perhaps even 5 years ago.
Absolutely.
Is that a fair statement to make? Why is that?
Well, in a simple way to describe it is simply technology. So as technology has made all of our lives, perhaps more complicated, but easier in some senses, so has the ability to help people with hearing loss. Mm-hmm. And certainly the first thing that most people go to when they have hearing loss is a hearing aid, and those have dramatically improved and are pretty much as fancy as you can get these days. Yeah. But there are many other things coming down that including what we're about to talk about, which is a cochlear implant, when a hearing aid perhaps isn't doing what it once was. And then there are other depending on the type of hearing loss that you have, because it's not all garden variety, so to speak, age-related hearing loss. Mm-hmm. And so we need other devices to help us.
I was kind of joking with you off air that I was asking you, do you do the Rush Limbaugh operation? And not to get political here, but I think many people out there, and there are a lot around here that listen to Rush, are aware of what happened to him and his hearing loss. And that's one of the specialized surgeries that you do. Is that the implant of the cochlear, or is that another surgery?
No, that's indeed what's called a cochlear implant.
Okay.
And that's really indicated for two different populations in general. Obviously everything's more complicated. Mm-hmm. The first one, which most people know about and is actually a little bit more controversial, are children who are deaf. So that's one scenario where cochlear implant is utilized and can be life-changing for that child, but it is a very complicated situation sometimes if you have with the deaf community and trying to negotiate what's best for the child. The other scenario are people that have a significant hearing loss, and usually those are adults in middle of their life, or a little bit older, and they have lost their hearing to the extent to where the hearing aids are becoming less and less beneficial for them. Mm-hmm. And that's the one, quite frankly, that most people aren't aware of, I think, as much around here, that indeed a cochlear implant can restore your hearing in that scenario.
Is this an implant that is artificially made, or is it, one of these organ donors type of things?
No, totally artificially made. Yeah, okay. Totally artificially made. And just like everything is a fairly complicated technological piece of equipment, and it's taken decades to get to the point where it is, and I'm sure will over the next few decades, quite frankly, over the next 5 to 10 years, will be very different probably than what it is today.
Yeah, this is maybe at the far end of the spectrum of solutions to hearing loss.
Yeah, absolutely. Yeah. This is, people come to see me when to discuss a cochlear implant when there are no other options.
Okay, so this is a kind of a last resort type of thing. Yeah, but you can do it. And you can't, is it fair to say that you would have to go to Dartmouth at a minimum to get a procedure like this?
As far as I know, and we've kind of looked around, indeed, Dartmouth would be the closest place. And then, of course, Boston.
Yeah. Of course, we were talking about the number of causes for hearing loss and so forth. Some of it, you mentioned children who are born deaf, it's genetic or something else. But for many people, for the majority of people, I think it is an aging process. At what point should people get their hearing checked, even if you don't notice a loss of hearing? Is there some routine for people to get their hearing checked at a certain age, or? Yeah,
that's a good question. Probably at some point in middle age, if you don't have any hearing loss or don't notice any hearing loss, it's good to get a baseline. And it's certainly not something that you have to do every year, or every 5 years. But during that time period, as long as you don't recognize, hearing loss. Once you have hearing loss, typically I like to, and especially I'm the person that somebody sends you to when you notice hearing loss. And if we determine that, then usually I like to watch it for a year or two to make sure that it's not going anywhere, so to speak, that it's not getting worse and nothing's evolving that as a physician I need to be aware of and look into.
ENT Associates offer audiology tests and things like right from
Absolutely.
You can one-stop shopping for your ears. ENT Associates.
Absolutely.
Okay, that's good.
And mainly as convenience for our patients.
Yeah. What you mentioned that hearing aids have technologically become much better over the past few years. Talk about hearing aids.
Sure. So I think the kind of probably it's good to talk about two different aspects of hearing aids.
Okay.
One is, and probably the one that most people find most important when looking for a hearing aid, is how discreet they've become. And it used to be, and we still indeed have hearing aids that are kind of hidden and put within the canal so that you can't see them to varying degrees. Okay. Now we've gone almost the other way, where we've developed, and again, it's because technology has become so small, an external device that is tucked between behind the upper portion of the ear that is very well hidden, and then a clear tube that runs in front of the ear and has a very small and fairly comfortable device that it goes within the ear. And I'm a little embarrassed to say, but there are people will come in with these types of hearing aids, and even as an ear doctor, I'll be sitting there talking to them and won't know that they have a hearing aid until I walk up to them to examine them, and then I have to ask them, will you take it off? So interestingly, it's become very discreet. So that's one development, and I would say probably 90% of the hearing aids that people choose these days are this type of hearing aid. From a technological standpoint, it gets very complicated very quickly about how it's improved. But so I'll just give you a little bit more of a simple example, or a little bit more understandable example, is the hearing aids these days do a better job at picking up the sound in front of us rather than all sound. So it has directional microphones where there's a microphone that's in front of you, and it's really geared toward that very difficult situation of hearing somebody in background noise. And that's the first thing that patients, even with a slight amount of hearing loss, will notice. And so hearing aid manufacturers recognize this and have tried to work very hard to try to solve this issue of being able to pay attention to the sound that's coming in front of us, which is usually the person we're speaking with, rather than the rustling of leaves or the conversation that's occurring over in the corner.
Yeah. Typically, does hearing loss just usually affect one ear, both ears? When you go for a hearing aid, do you get two or one, or?
Yeah, no, that's another good question. Usually it involves both ears. And if it doesn't, that is a cause to see me. to see, or one of my colleagues.
Yeah.
So
what would that mean, possibly?
Well, it's very worst, and this is very rare, so I don't want to scare the listeners out there. But it's very worst. There can be a small benign tumor that's on one of the nerves in the inner ear, and that can cause a one-sided hearing loss. And it usually comes with a one-sided ringing in the ear as well. And again, that's rare, but that's rare. Something that we always have to pay attention to.
We have fun sometimes with hearing aids, and I won't embarrass my dad, but I think a lot of people who have dads and moms with hearing aids, he hasn't got his hearing aid turned on, or all of a sudden you hear the squeaking.
The squealing, right.
And I'm going to get killed when I get out of here today. I know, but I'm just a little lighthearted part of this whole medical process here. Preventive health measures. We typically ignore our ears. We may clean them, and that may be dangerous. How do you properly clean your ears?
Please, everybody.
With a fork?
No.
Put a fork right in there, huh?
This is, if they're beyond cochlear implantation, which is very interesting. Probably the conversation that I have with most of my patients is earwax, you heard me say it, is a good thing.
Oh, it is?
It is.
Ah.
Okay, so earwax within your ear canal, that's nature's way to keep it clean. So, and it's also nature's way to prevent infection. And so as long as it doesn't cause hearing loss, and most of the time I have relatively few patients that have so much wax buildup that I have to see them on a regular basis to remove that wax so that they don't have hearing loss. But as long as it's not causing hearing loss, then it's a good thing. And most people will try to get it out, but it's actually the skin within the canals carries it out. It migrates from the inside out and carries the wax with it. So that's why we always seem like we have wax in our ears, because the skin is consistently carrying it to the outside. And so, throw Q-tips away. The Q-tips pack the wax in further, and that's makes it very uncomfortable and difficult to get that wax out.
Just the opposite of the result you're looking for.
Yeah.
And if you push too hard, you can seriously injure yourself.
Absolutely.
Can't you?
Yeah, you can get a perforation or even dislodge some of the hearing bones.
And are you discouraged by music? And boy, I loved loud music when I was growing up in the car, but we didn't have the sophisticated 50 speaker stereos in the cars that the kids have today, or the iPads, pods, or whatever you call them. Mm-hmm. Are you discouraged by the number of kids that are blowing their eardrums up with loud music?
Yeah, absolutely. Everybody in my field is discouraged by that. I think, loud music, for better or worse, is going to be part of, growing up to a certain extent. I think, the thing that I suggest are just simple guidelines for people, especially parents, is if your child has earbuds in and you can hear the music, it's too loud. So that's a general guideline. And indeed, otherwise, from a hearing perspective and how to protect your ears, any time you would have to raise your voice above the sound that's in the environment, that's a good indication that you probably want to consider using some hearing protection. And for most people, that's the power tools that we use around the house, or lawnmowers and such. That can generate a lot of noise. Yeah. And you think about a relatively short exposure to that noise carried over a lifetime, and suddenly you're looking at, quite a bit of noise exposure that could indeed cause damage.
That's the problem. 30-second answer, if I can get you to do that.
Okay, I'll try.
You've seen the TV ads with these devices that you can hear across the room? You can hear what that woman over there in the corner is saying about your husband. Have you seen the ads for those things?
No, I haven't.
They amplify sounds within a room.
Okay.
You can get
all
two.
Sounds?
All sounds. 2 for $19.99, as a matter of fact. Are those dangerous? to hearing, not having seen one or used one, it's hard for you to say, I guess.
It's hard for me to say. If they amplify sound and if they're going in your ears, then they have the potential, especially if they don't have the fancy stuff.
It's
like
not
hearing aids to cut off.
It's not directional. It's everything. You get everything. Boom, blow your ears right up. Thank you for coming in this morning.
Thank you for having me.
And Dr. Chandler Marietta, ENT Associates, and LRG Healthcare, our guests this morning, all about ears and hearing. Interesting subject. That'll wrap it up for Focus on Your Health this morning.